We have a patient coming in to get a revision of her ear gauge repair. So she had those big ear gauges in her earlobes, had them removed a couple years ago, and now she's coming to me to get them revised because they just need a little more skin removed. She had the extra skin removed previously by another doctor, and they're almost there, so we're just going to tweak them a little bit more, make them even more natural looking, look like there was never anything there to begin with. This lovely patient has agreed to let us Snapchat her to record kind of what we're doing today. She had these large gauges in her earlobes in the past, and about 1.5 years ago she had them removed. And you can see how the doctor did a decent job of getting rid of the obviously the excess skin, but you can see there's this really kind of excess earlobe here. It's kind of a little bit pointy that the patient didn't like that. So what we're doing is we're going to re-excise a little bit more skin, remove a little more skin to help improve the contour, make the earlobe look a little smoother, a little rounder rather than pointy. We'll show you the earlobes, photo of the earlobes without the markings in case those are distracting, but I just want to point out what we're doing is we're going to make an incision along both those lines, but if you'll notice right here, I kind of make a dog leg on each limb, and the whole idea for that is that if we just went straight down, that would leave a notch. After I remove the skin and sewed it together, that would leave a notch there. So with these little dog legs, it allows this part of the earlobe to rest on that edge of the earlobe, so it's a nice smooth contour. So now we'll show you the earlobes without marking. Here you can see the earlobe without marking, and again, the doctor did a really good job of removing there was just a ton of excess skin here, as you can imagine, with those gauges within the earlobe. But with this point here, it's just a little too apparent that something's happened to the earlobe, so again, we're just going to remove that pointy area to make it a little smoother curve, and we'll do that on both sides. That was the right lobe we showed you. Here's the earlobe on the left, and you can see it's a little even more pointy on that side. So it's, again, I'm not trying to badmouth the other doctor because they really did a good job with removing all the excess skin, but it's just a little bit too much of a curve and not as much of a gentle curve as what we're looking for. So we're going to start by numbing up the ear, and we do the markings before we inject, because after we inject you'll see that the earlobe really blows up like a balloon. And we're injecting local anesthesia to make it numb, obviously, but it's got epinephrine in it also just to minimize, that constricts the blood vessels to minimize bleeding. So you can see the earlobe's already starting to get bigger and making those lines bigger. So glad we put them on first. At this point, we're going to take our time. We're not going to rush, and I don't want you to think we're just being slow on purpose. We're actually letting the epinephrine kick in, constrict those blood vessels to minimize bleeding, and that takes several minutes. So now we're going to set up our sterile tray and everything and get going, but we're going to take our time. So I don't want you to think we stepped out and we're having a smoke break or something, okay?
So have you ever had any piercings?
No piercings, no tattoos. Yeah, sometimes people make those decisions when they're young, and I actually made no mistakes when I was younger. I made no bad decisions when I was younger. We've given the epinephrine time to soak in. We've cleaned everything up with alcohol, and now we're going to use this knife blade to make our incision. I've already checked the patient. She said she was numb, and I'm going through the skin here, and then I'm using a tongue depressor back here, this wood tongue depressor, kind of to stop the knife from plunging into the patient's neck, which the patients like that. And you can actually hear this kind of sawing sound as I'm going through the skin here. If I stop talking, you'll probably be able to hear it.
You can hear it.
So here's the piece of skin that we've cut, and I just kind of go through. Sometimes it doesn't always go through the back part of the earlobe, so I'm just going to finish that part up here. So I have the earlobe in 3 pieces now. So you have the part closer to her head, the outside, and we're going to just bring that in. You can see how that's going to provide a nice smoother curve. I'm going to take out this middle piece. Give that to the patient to take home. This is when you know the epinephrine's working well. So we've obviously cut out this section of skin here, and it's just not bleeding, and that's all because the epinephrine has constricted the blood vessels. The epinephrine was in that numbing medicine that we injected. So I'm going to start sewing this closed. For those of you at home taking notes, this is a 5-0 chromic, so this will dissolve on its own. Get around the hair here. sew this up. So you can see after we remove that excess skin, we just sew it right up, and it's just really got a nice natural curve to it. And we'll show you the before and after now. Get started on the other side now. I'm trying to remove some of the old scar in the process too, so just going straight back to that tongue depressor. I'll angle it. After we've split it in front and behind the area that we want to remove, we just amputate it just like that.